Hello, folks. This is Dr. Reddy from Seven Oaks Pet Hospital. And yesterday we had another breaking news regarding two cats in New York were found positive for COVID-19, which was stated in a press release from USDA Animal Health and CDC. And we do have right now at Seven Oaks Pet Hospital to test the cats at our facility. We can take the samples and send it to a reference lab, and that lab can test cat samples and give us the results. Uh, so that is a good thing. But at the same time, I don't think at this point we have any evidence suggesting that cats can transmit to people. But the two cats which were positive, they did come from people to animals. Um, so that's another thing I wanted to share with you guys. And if any of you guys do suspect or being positive, I mean cats or ferrets being positive around people with COVID-19, please let us know. And if the cats are showing any signs of upper respiratory infections, coughing, sneezing, or vomiting, diarrhea, and fever, those are the signs for coronavirus infection in cats at this point. So that way you can call us and we can take the necessary precautions in testing those pets. And again, feel free to um, let me know if you guys have any questions regarding this. I would be glad to answer. Thank you. While I'm waiting for some questions from the audience, I like to uh, talk about Seven Oaks Pet Hospital, how we changed our protocols in the last month since the COVID-19. In the last 1 month, we've been doing a curbside valet vet service, which seems to be working okay while taking care of pets which are in real emergency or medical needs. We have not started any of our elective procedures at this point, including spay neuters, unless we think that it is medically needed. But we've been working basically on an emergency basis, or any sick pets or any pets which are uncomfortable or in pain. We try to help those pets out. And 4 weeks have been a little bit stressful for the team and for the clients. I understand, because this is something a new normal. We are all trying to adjust to it. But hopefully sooner we will be out of this, and we could start seeing those pets in the exam rooms, in the comforts of our exam rooms. That will be much more better, I think. But at this point, I think our team is definitely getting used to this new norm. And clients have been really, really supportive. I really appreciate each and every Seven Oaks client for understanding our situation in these difficult times. And I like to thank my team also. They've been really, really uh, understanding with the situation, and they have been quite helpful. And so far, we're all safe and healthy. That's something that I'm very happy to say, that we have not had any um, any untoward situations at this point, and we continue to serve the community in and around Wesley Chapel. And again, we always welcome walk-ins, especially if they're sick and they're suffering, because that's my most important thing. The reason I'm here today is to help all those pets which need me right now, and so I can alleviate or take them off of the pain and suffering as much as I can. And at Seven Oaks, we do have a pet urgent care, which does serve the purpose of emergency sick visits, so you don't have to wait any longer than needed. It's We have a 0 minutes of wait time at this point, and also I wanted to focus on a little bit about Pet Vet Express, which we started a month ago, incidentally, when this COVID-19 started. And at this point, we are offering a free service to all the clients within the 7 mile radius of Seven Oaks Pet Hospital. Either it's a pet pickup, drop off, medications, prescriptions, food, any of those things clients can request, and we would be gladly able to drop those things at your doorstep within the 24 to 48 hours time frame. So please utilize that service, and we want to extend probably into the next month as well, and see how this service helps to keep our lockdown condition or stay at home condition, so that we are not, obviously we are still following the government regulations. um, those are the few things I would like to share at Seven Oaks Pet Hospital. And yeah, please feel free to ask me questions. I do see some questions popping up on my screen. See if I can answer some of them. The services we are offering at Seven Oaks right now is, other than the elective procedures like spay neuters, we offer ultrasounds or laparoscopic procedures, any major surgeries, if even pets need blood transfusions or any sick pets, and we want to keep the cost also at as much as lower as possible. And we do have another policy at Seven Oaks, not many of the clients know, which is any pet walks into our doors, even if the clients don't have an ability to pay money, and they can show us that they really cannot, they cannot afford the treatment. So we have a Hermione Duncan Reddy Foundation, which is a HDRF foundation, and we use funds from that foundation to help the clients who need these sometimes little expensive procedures to save their pets. So we are very proud to say that we've been doing that also. Again, not many of our clients know about that program we started. So in other words, my main goal is I don't want any pets suffering if they if I come to know through any other source, or if they walk into our doors. We try to help the pets and take the suffering away. And let's see if I have any other questions. I'm hoping that you guys all can hear me okay. If not, I can speak up a little bit or louder, I guess. Um, but again, I really appreciate you guys, and I thank all of you for joining this on such a short notice. This is the first time we are doing it, so I just wanted to try it out and see. And then also another thing we started doing is televet services. That also started a month ago, offering it to the clients who are pets, the clients who cannot bring their pets into our facilities, or they don't want to drive during these difficult times, and we understand. So we have a televet services where you can get on the camera, and or it's basically like a FaceTime, I say, and get on the camera, and then we can look at the pet and see what is going on, and maybe we can prescribe some medications or a treatment over this telemedicine. Sometimes we can do that way. You can stay safe in your home, in the comforts of your home, and then get the treatment done. Sometimes it might not work that way, and we may have to look at the pet and say, hey, you might want to bring your pet to the pet hospital so we can check him out and see what else is going on. So it could go either way, but majority of the time what we have done so far, I think it seems to be working fine. where pets, we have seen them and we could recommend some treatment, the owners will come back and pick up the medication, or as I said, we can use our pet vet express to drop off the medication at your doorstep. So that is another great service we have started during these difficult times actually. And I wanted to share with you guys, all of you guys. Thank you. And again, I think there are a few more questions are coming up. Yes, we are doing some dental work. Teeth cleaning has been happening. Again, not for routine teeth cleaning, but if the pet is having some bad breath where they have a bad tooth infection or need some extractions, we definitely are doing it a few dentals on a weekly basis. Um, but we are not doing yet the routine dentals so far, but we will be start seeing them as well. Another question I hear is a puppy that is due for another set of vaccines during this quarantine time. Yeah, that's a great question. I think if the puppy is within the 4 weeks time period, then I think you should be okay. But if it's exceeding the four weeks of time and you still need boosters, I would say I think that is not part of the routine services. That is definitely a health concerning towards the puppy. So you should bring the puppy in to get the vaccines done. So, in other words, yes, that puppy needs to have a vaccine done if it is more than 4 weeks time period for the boosters, because we definitely don't want to jeopardize a puppy health in these during these difficult times, especially, and keep the immunity going on for puppies as well. Because again, like dogs, we have not seen in US yet any positive cases for coronavirus. But I think in Hong Kong, I think it was reported 2 dogs, but I think they did pretty well. And the difference is between dogs and cats is the epithelium of cats has a same type of receptors as humans have. So the virus can attach to those receptors easily in cats and ferrets epithelium than the dogs. And that is the reason cats and ferrets are more prone to it uh, than the dogs. Another question is, do I need to wear mask when I come into your clinic? Absolutely. I think we are definitely recommending every client to wear the masks if possible. That would help. If they can't, we are trying to limit them, and they're staying mostly in their cars and in the parking lots. So one of our team members will go and pick up the pet and bring the pet into the clinic. And one more last thing is we do plan to do this live video chat. I think this is my first time. I've never had a Facebook, so I don't know how this works, but we plan to do once a week. Especially, I think Thursdays noon time we are picking up, and not only me. I think rest of my doctors would be hopping on here, especially. Dr. Vishik, Dr. Pelrin would be, we will be rotating with all the doctors. Um, and also, quick thoughts on the Seven Oaks Pet Depot store we have here, which has been open and clients are welcome to come in. And obviously, we're limiting a few clients at a time, so we continue to maintain the social distance, and that has not been that of a big problem at this juncture. But again, we are all welcome to come to the pet store and shop for pet food or pet treats and pet toys. I see a message from Miss Melusa. Hi, Atlantids. Her eye is doing much better. I'm glad to hear about that. Thank you so much for giving us the feedback. And also, I would like to request if you guys have any special topic you want me to touch bases, please text me or I think on Facebook, put it on the Facebook so we can look at it and see if we can cover those topics for you on a weekly basis. Again, I appreciate you guys' time. Thank you so much for joining this, and we will see you. Oh, hi, Miss Mace, Miss Mace, Sandy, Simon, Samantha, and Yoshi. Yep. Hi. Thank you so much, Miss Mace, for joining as well. All right. Thank you, guys, and we will see you next week. Thank you.